Hi, Stephen, and thank you for the introductions. So yes, the top 10 insights of this webinar is about the role of values for informing health system decisions in health system financial decisions. This is part of my dissertation for my thesis in health policy. And okay, it's a pleasure, and I am very excited to share with you the insights from this thesis. So I always explain that it's important to be clear about the definition of values. So for this piece of work, we decide to take this definition, that is that values are principles or criteria for selecting what are good or better or best. So this definition by Schwartz implies that value is always something that is good for the health systems, something that is positive. So we don't classify values between bad values and good values, but we take a definition that gives the sense that everything that has this name of values or principles are good. So according to Beck, there are 5 categories of values: basic, spiritual, moral, social, and political values, and intermediate. For our investigation and our research, we decided to choose these social and political values because are the values that are implied in the decision-making process. So everybody has basic values and spiritual, but we wanted to discuss the social and political values that play a role when the policymakers and the society make decisions. So this is important to be clear with those 2 big definitions. So to put this issue in context, so we know that values are important at all stages of the policy process, but we are not clear about how they are incorporated into policy decision making about health systems. And we know that this is an emerging field of study in the world, but particularly in Latin American countries. So that's the reason why we decided to make the dissertation about the role of values. In the dissertation, we did 3 research. One is a critical interpretive synthesis, and we were trying to develop a framework useful to explain how values are used in the policy decision making in different Latin American countries for health system financing decisions. So the product of this first study was develop a framework that explains that, the role of values. With the second and the third studies, we apply this framework in 2 cases with a methodology of a multiple case embedded designs. And we choose Chile and Colombia as cases to test the framework developed in the CIS. And in the discourse analysis, we analyzed political documents, laws, Congress hearings, media documents that analyze 4 decisions, 2 in Chile and 2 in Colombia. And in the third study, in the case study, we interview policymakers and stakeholders and try to see how policymakers and stakeholders understand the role of values and how they apply those values in the same 4 decisions that we choose for the discourse analysis. So that is the methodology that give the insights that I am presenting today. So I would like to make a summary of the top 10 insights that I'm going to discuss today. The insight number 1 is that it's important to clearly distinguish what is a social value, even if the value is not explicitly exposed in the laws and the documents of a health system. Second, that values play different roles at different stages of the policy process, and this role depends on what is expected by the policymakers and by the stakeholders. The insight number 3 is that identifying what are the goals of a particular health policy is the most important thing to guiding the policy development according to the values. The insight number 4 is that to achieve a goal, it is necessary to incorporate technical values, which role is secure the sustainability of the health system, but also the sustainability of the policy decision. The insight 5 is that the process of developing the health policy by itself, this means the policy process require also some values that make the decision transparent, accountable for the society. Insight number 6 is that the health system and the political system, the interest groups, the prevailing values of the society and the people in the community and external factors bring more values to the policy process and make the policy decision making more interesting and funny. And insight number 7 is that when values are aligned with influential forces, they come to be important in the health policy decision making process. So insight number 8 is that the values explicitly described in laws and policy documents are not necessarily the values that inform the policy process. Insight number 9 is in health policies, only a small set of prioritized and often competing values are considered. So it is possible that health system guiding document or a policy document or a law that guide the health systems in a country has a several number of values, but it's possible that when policymakers have to make a decision, they only use 2 or 3 or 4 values, and maybe they try to make a balance between 2 or 3 of them. I am going to explain that in point 7. And the last insight is that values are used to frame problems in meaningful ways to guide policy development as pragmatic instruments to make decisions and as a way to legitimize decisions. So I am going to begin with number 1, that it's important to clearly distinguish what is a social value, even if the value is not explicit in the laws. So we identify in our study with the critical interpretive synthesis, we revised almost 260 articles published in Latin America regarding changes in the health systems in Latin America. And we identified that stakeholders called values to many different things. Some of them are values or principles, but some of them are strategies, mechanisms to make the policy implementable. And so it's important for the policymaker and for the stakeholder and for the researcher to be very clear in distinguish what is a social value and what is not, because policymakers could call some of those things values. So you can see here, okay, my presentation is a little bit more beautiful, so that we identify a lot of values that are very important in Latin America. Universality, equity, quality are very important values in Latin America, besides solidarity. But many things we identify that stakeholders called values like Millennium Development Goals, profitability, interculturality, market was very important in our review, privatization, cost containment, efficacy. So there are a lot of things. For example, one that is very important is decentralization. Decentralization was a value very highly identified in our revision. in our review. And we think that that value was important given the health systems reform in the 80s, and decentralization was one of the values of the World Bank for the Latin American countries and for the reforms of the health systems. But when you have to analyze that decentralization, it may not the characteristics of a real value, but more like a strategy or a mechanism to implement some reforms. But decentralization was identified for many countries in Latin America like a guiding value of the health system. So that is the first point. We need to try to identify what is a real value for the health system. The insight number two is that values play different roles at different stages of the policy process. We developed this framework, and you can see that in the middle of the framework is goals that are the values that are the most important to make decisions in the health system. We identify that universality, equity, solidarity, and quality are the most important values in the health systems in Latin America, and that are the guiding values. So every health system wants to make the healthcare for everybody in an equitable fashion, with quality for all the healthcare that is delivered, with the solidarity of our health system, because in Latin America, many people is poor, so it's necessary that people that has more better socioeconomic status help to those people that has not or are vulnerable communities. So that is important for Latin America. And then we have in this framework the stages of the policy process: agenda setting, policy development, implementation, and policy evaluation. We have other category of values that are technical values, that are values that help to make the decisions sustainable, accountable, to evaluate the effectiveness of that decisions. We have governance values that are surrounding all the framework, that are values that are implied in the policy process. And outside of the framework are situational values that are different things that come to be influential in the policy process. And I am going to explain those values, how to play a role. But in this point, about the insight number two, so values dependent on the state of the policy process, they play different. So for example, goals for the stage of the agenda setting, many of these goals help to decide what are the priorities of the health system in terms of what policies are important to guarantee those goals in the health system. But in the policy development, for example, these goals play a different role because they help to prioritize what strategies are more suitable to accomplish these goals that the government or that the policymakers decides that are the goals of the health system. So they play different roles at different stages. For the insight number three, so it's important to identify what are the goals of a particular health policy. In our review in the critical interpretive synthesis, and then in the studies 2 or 3, and the discourse analysis and case study, we identified that sometimes policymakers propose a policy, a health policy, which has a purpose and a value that is guiding this health policy, but in the stages of the implementation and evaluation, they use a different value to evaluate the effectiveness of the implementation of the policy. So I am going to explain. It's sometimes, for example, governments are trying to make some strategies of cost containment, and the policy is oriented to cost containment. But after they implement the policy, at the end, they can use indicators of equity or quality to make the measure of the effectiveness or efficiency, the implementation of the policy. So, and that's important that in the policy process, we define what are the goals of a particular health policy, and we understand that each decision that we make surrounding this policy has the purpose of achieve that goal. So goals, in this case, we say that, for example, in agenda setting, goals help to decide what issues come to the agenda, come to the decision agenda and to the governmental agenda. And most of the times, the lack of achievement of a goal is defined like the principal challenges faced by the health system. So if a problem is described like a problem of universality or equity or quality, and those aspects are very important to decide what are the goals of the policies. But the perspective underlying the goals shape how some issues gain prominence in the government agenda. For example, for a policy decision, maybe it's important universality, but you can consider universality from different approaches or perspective. You can say, or for a policymaker, for example, they can consider universality like a basic universalism or an egalitarian universalism, and then the policies and the strategies and the mechanisms to implement the policy are related with the perspective underlying the goal that you decided like the most important to achieve. So that is very important because this changes the way in which the policy is implemented, developed and implemented. In agenda setting is also very commonly that the comparison of the goal against what it has achieved is an important factor in agenda setting. So many policymakers, for example, compare the goal or the achievement of universality against a previous stage of universality in a different government or with different policies, or they can compare universality in this country against other country with similarities to try to see how to get to an indicator of achievable universality. So that is important how the policymakers compare these goals against a previous situation or against a different country with similarities in economic development, for example. In policy development and implementation, policies that are aligned with the health system goals are more likely to be prioritized for implementation. So those policies that come to solve a problem and they are aligned with the idea or with the more prevalent value in the health system, they are more likely to be prioritized for implementation. So not only in the agenda setting, what brings some issue to the agenda, but also to implement the policies and to choose different perspectives or different options to be implemented. We propose that there are something like intermediate values in this category of goals-related values that are used like surrogated outcomes of evaluation of the performance of the health system. For example, the goal of the health system, it could be universality, but policymakers could use acceptability, affordability, or accessibility like intermediate steps to achieve universality. And these surrogated or intermediate values play a very important role in the policy decision making because they could be more easy to measure and to evaluate when a policy is implemented. So these intermediate values play a very important role here. The insight number 4 is that to achieve this goal that we proposed in the insight number 3, to do that, it is necessary to incorporate technical values that secure the sustainability of the health system. So if a government decide to implement primary health care in the health system and to make this decision universal for all the population in the country, the second movement of the policymaker should be to decide what technical values are important to guarantee that this new decision is sustainable for the health system, that the resources or the availability of funds of the health systems are enough to funding the decision, that the strategies that are implementing and effective and in many countries are cost effective. So this package of technical values help the policymakers to be sure that the implementation of a policy or the decision of an option is sustainable and is factible in a country. So, for example, in agenda setting, technical values are used to frame problems regarding the efficiency or financial sustainability. So many things, problems in the health systems come to be important in the agenda setting because they put at risk the efficiency or the financial sustainability of the health systems. And these technical values influence the government agenda when a problem puts that economic stability at risk in the health system. And for the policy development and implementation, these technical values are used as indicators of policy effectiveness, efficiency, and financial sustainability. So in this perspective, we don't think that, for example, equity and efficiency are contradictory values, but if you propose a policy which objective is to achieve equity, maybe you need to consider a technical value like efficiency to be sure that this purpose, this goal, it could be achievable for the health system. Then we move to the insight number 5, that is that the process of developing the health policy by itself, it must consider values that make acceptable the decision. So here the values are not related with the goals of the health system, are not related to with make sustainable the decision, but is related with the way that the policy process is thinking, is developed by the policymakers. So the values, the governance values are those values that guarantee that the policy process is transparent, accountable, that the decision has some kind of governance, that is free of corruption, that is consider social participation. So those values are related with the process of the decision. And it's very important that the policymakers consider that values according with the values and preferences of the society, of the citizens, patients, and other stakeholders, and considering the particularities of each country. For example, in Latin America, we identify like a problem in many documents related with the corruption. So stakeholders and citizens and patients would like to see in the policy process a more transparent way to make the decisions, and this value should be included in every policy process that is considered. Governance values in the agenda setting are used to frame problems in terms of corruption, was very, very important in Latin America, and failures in regulation or in governance or lack of social participation. So these governance values can bring something to the agenda because they are framed in this way. And governments and policymakers use governance values to a way to gain legitimacy in policy prioritization process, but also the consider governance value is a strategy to make a policy more acceptable for the citizens and patients. So it's a way to gain legitimacy, not only in agenda setting, but also in policy development and implementation. And most of the values related with governance values are used as indicators of good governance in the health system. And then we have insight number 6, that is the health system and the political system and other characteristics that are, we call it situational values, come to be very influential in the policy process. So we identify 4 groups of characteristics that comes with the values. So for example, the institutions, how the institutions are organized, they put some values in the discussion. For example, we identify that it's different, the values of health systems that has a more private institutions that are more in the way of be private institutions than in countries where the prevalent institutions are public funding institutions. And for example, in many countries that are social security health systems, or a mix between public and private institutions in comparison with institutions with a big participation of private insurance, for example, they play different values in the policy decision making. And that's the reason, if you remember in one of my first slides, that we have a map of Latin America with different values. In that slide, we identify very strongly the privatization. Privatization was a value that was promoted by the Monetary Fund and the World Bank in the 80s, like a strategy to develop the health systems in Latin America and to promote the development of a strong health system. So that, for example, is a value of this kind of health systems that promote the World Bank. The second is related with interest group, that is here down. Interest group bring values to the policy decision making. So depending on what is the interest group that is strong in a country or is strong in a particular health policy decision, they bring their own values to the policy process. And this is very important to many decisions and financial arrangements. The other category is related with the prevailing values of the citizens and the community, and they also bring different perspectives to the policy process. And the external factors, those external factors are, for example, policy learning or strategies that are implemented in other countries. Most of the time in countries that are neighbors, for example, in Latin America, it's very common that pensions policy that was implemented in Chile was helped to make some decisions about pensions reform in other countries in Latin America. So sometimes what a country do in a particular field come to be influential in another country, and those values of those decisions come to be influential in the policy process. So we want to consider that there are things outside of the policy process itself that help to bring values, I don't know, complicate the decisions, but these values that come from situational perspectives make more rich the discussions in a policy field. And the insight number 7 is that when values are aligned with influential forces, they come to be important in the health policy decision making. So we have here a map, a figure of different values depending on our how frequently and how strong was the use of these values for the policy decision making. So we can see equity, universality, efficiency, accessibility, decentralization were very important values, but we have an amount of different values that play different roles in different stages. Our point is that when the value is aligned with an influential forces, an external forces, interest group forces, and institutional forces, the ideas of the citizens and the public opinion. So maybe this value come to be influential in the decision, and the decision makers should consider this before to make a decision. One of the examples is with Chile, that they have a value, very interesting value, that is individuality. So for Chileans in our research, for them is very important the possibility of the free choice. So to decide if they want to be affiliated to the private health system or to the public health system, it's very important for them. So any decision regarding the unification of the public and the private health systems in Chile should consider the values and preferences of the public and the Chilean citizens, because for them it's very important to sustain the possibility of deciding what health system they can affiliate. And inside number 8, so the values explicitly described in the laws and the policy documents not necessarily are the values that inform the policy process. And I think that this example that I just discussed about Chile, so about the individuality or free choice, those values are not in the laws and the policy documents of the health system in Chile, but they are very prevailing values of the citizens. So it is possible that for some decision, some values are very important, but they are not explicitly in the documents. So it is important for the policymaker and for the stakeholders to identify what are the values that are not in the laws, but they play a very strong role in influencing the policy decision making. And in the insight number 9 is in health policies, only a small set of prioritized and often competing values are considered. We identify, for example, in Colombia, that our health system has in the laws and in the policy documents almost 27 values. And when we discussed these values with the policymakers in the third study that we have a methodology of interviews, stakeholders and policymakers say that when they have to make a decision, they only consider 2 or 3 values. So for example, in the case of Colombia, for the decision that we choose for our study, that was the declaration of health like a fundamental right, policymakers inform that they use the values of human dignity and sustainability. So the discussions about how to make and how to decide that health is like a fundamental right, the discussions consider the values of human dignity. So considering that it's important that every citizen in Colombia has the opportunity to access to health, to accomplish their personal beliefs, and to feel that her life or his life is dignified. Against sustainability, that was a value highlighted by, for example, policymakers from an economic perspective, because the consideration is that if all the citizens want everything to make them happy and feel in with human dignity, so it could be very expensive for the health system to provide and to deliver everything that people consider important to achieve that goal. So when the decisions have to be made, so policymakers and stakeholders consider only a small set of values, not a big sample and several values that are in the laws, but generally 2 or 3 values that are very competing between them. And this is very important because this facilitates or simplify the process of analyzing the policies that should be developed. And the last insight is that values are used to frame problems in meaningful ways. So values can be used to try to show that something is very important. It's very important because countries have problems with accessibility or universality or with inequity or with not enough quality in the delivery of the healthcare. So this frame the problems in a very meaningful ways. So that is used for the values. But also values are used to guide policy development because according with the values that are prioritized by the government, they decide what policy options are more acceptable, feasible, achievable in a country. And technical values, for example, are used as pragmatic instruments to make the decisions. So we can try to pursue, for example, universality and quality, but policymakers and stakeholders should try to see what of different options are more pragmatic and are more achievable and more feasible to implement in a country. And finally, for example, governance values are used as a way to legitimize decisions. So to make the decisions are acceptable by the citizens, by the stakeholders, by interest groups. So they make that the process by itself is accountable and acceptable for the citizens. So we should consider all those groups of values to make a decision to have more, to be more likely to be successful in the implementation and to achieve the indicators and the outcomes that we plan since the beginning. So this is my top 10 insights. I would like to give my acknowledgements to Mike Wilson, that was my supervisor for my thesis dissertation, John Levis, that is also from my thesis committee, and Julia Adelson, that I know a lot about how to incorporate policymakers in policy decision making and to try to put together the role of values and the policy decision making. So here is where I heard the questions.
Great. Thanks so much, Marcela, for a great presentation. That was some very interesting insights into the importance and the role of values in informing health systems decisions and how that comes into play with financial decisions as well. I would, as you said, like to open it up to any questions or comments. If you have anything you'd like to share or any questions, please use the chat box that is likely in the bottom right-hand side of your screen to ask them. In the meantime, I would just like to mention that a recording from this webinar will be made available on the McMaster Health Forum's website. So if you want to share it with any colleagues or if you want to come back and watch any parts of it again in the future, it will be available there. And also that we do have a number of other upcoming webinars that are listed there as well. So if you enjoyed today's webinar or are interested in any other health policy ones, I would encourage you to check those out and register for ones of interest. Not seeing any questions coming through yet, Marcela. You did a very thorough presentation, but we'll just give it a minute or two in case people are typing. While we're just waiting, do you have any kind of last comments or anything you'd like to make?
Yes, I would like to say that John Levis has proposed a couple of times before that I should try to put this framework of values in something that is very or something that policymakers should have an or to try to use values explicitly or yeah, explicitly in each, very applicable to try to help them to consider, if you are going to make this decision, try to identify what is the goal, try to see how to make it sustainable, try to see what is important to the people, that make the people to accept the policy or to participate in the policy, and try to consider what is happening in other countries, in other sectors, with how that policy affects different interest groups, how this is compatible or feasible for the health system. So I am trying to put this in some kind of tool that is very easy to use in the every day of the decision making.
Okay, that's great, Marcela. I don't see any other questions coming in, so I think that we'll just end the webinar a little bit early, but I would like to thank everybody who joined us today. And again, to thank you, Marcela, for a great presentation and for joining us today. Again, we do have other webinars coming up in the next few months, so hopefully we'll see some of you joining us back again in the future. Thanks, everybody. Have a great afternoon.
Thank you, Steve.